I think that in my hospital, we are a bit lucky because years ago they started gathering information about our CO2 footprint. So we do have data and we share them in our annual review. So people know also that we have the data and that really helps if you want to change things. We are a large academic hospital in the Netherlands, and our scope 1 and 2 is about 90,000 tons of CO2 per year. And the data you see now is from 2020. And we are about to get scope 3 data as well. We ran a huge project, and if you add scope 3, so that means that we do have the footprints of everything we buy within the hospital. So that's all measured and calculated. And you can add another 2,000 tons of CO2 per year. So our scope 3 emission is huge. So it's time for a change. We are going to change electricity, which is 50% of our CO2 footprint, if you check this graph with scope 1 and 2 data, but it takes years for my hospital to change this because we are so big and we need additional resources to change from gray electricity into green electricity. But in the meantime, we started on our 15% waste processing of materials because I think that's the thing we can change as healthcare professionals. And I also like changing it. So I will show you what we did. Can you give me the next slide? I think people that work in the ICU recognize, I think, all the materials on this bed. This is a picture that we prepared for a newspaper item last year, and this shows all materials that we use for one day for one ICU patient, and this creates 7 bags of waste per patient per day. So I think we have to make sure that we go back to maybe 1 bag per patient per day, and that's our mission for the next years, at least in Rotterdam in the Netherlands. The next, please. But then we have one problem, and I think you will recognize it. How can we change from a linear system to a circular system? I think you can only do this if you have data. So what products do we use? How much waste do they create? What's the impact on the environment? What's the supply chain adding to this, and how can we avoid all this waste, and how can we close our resource loops? And these questions we tried to answer in our material flow analysis project, which is shown in the publication in ICM. And it was really actually based on these 3 questions. Next slide, please. And oh yeah, well, this is familiar. You can skip this one. And we asked Metabolic. Metabolic is a Dutch company, and they are specialized in material flow analysis. They did this before in cities or with the whole bicycle chain, but never in healthcare. So we asked them, could you please help us? And can we be your first project in healthcare with this important topic? And they said yes, and we of course paid them for this project, but with their help, with all their sustainability consultants, we were able to perform this material flow analysis. We also performed an impact analysis, because if you start doing a material flow analysis, you will end up with hotspots, and you also want to tackle the hotspots in terms of environmental impact. So if you want to tackle these hotspots, you need also an impact analysis to make sure that everybody that's involved in this whole chain is at the table discussing how to change their products. This might take years, but we need all these people. And also for an academic hospital, it's important that we can do some innovation. So this was also tackled within this project. Next slide, please. Well, how does a material flow analysis look like? This picture is quite simple. You need to know all your inputs: energy, water consumption, use of materials. Then in the middle, there's the ICU. It uses it all, and then you have to calculate all your outputs. And we chose to calculate CO2 emissions, water use, product use, and waste. So not only CO2 emissions. Metabolic is a company that's used to tackle this a bit broader. So they also want to know how much water you need and some other definitions. And we just copied their definitions to make sure that we had a material flow analysis that they know how to handle, because they never did an ICU before. So we asked them, please do what you normally do and then copy this to our ICU. That's what they did. Next slide, please. Then we started this project. I think it was in the middle of the second wave of COVID. We were busy, but this also created new energy, and everybody really liked it from the beginning. So we had quite an energetic team, and this worked. I don't know how we did it. If I think about it, I worked like 80 hours a week, but this project was so nice and gave so much energy that we just finished it within 6 months. So we started with a collection of data, and we needed all data from the ICU. So materials, water, electricity, all kinds of stuff. I had help from someone from our procurement department, and he knew where he could collect all these data. Metabolic measured everything. They checked the packaging. They checked the kind of plastic. We knew exactly what a syringe, the weight of the syringes. We knew all the sizes of the infusion bags, and we weighed them all. So with those data, we could calculate the mass and the CO2 impact. Then we performed 3D impact analysis, and we determined the hotspots together in workflow sessions. And at the moment, we are checking the innovation opportunities, and I think we already made some nice progress. So I'll tell you in the end. Next slide, please. The data collection, I think, took about two out of the 6 months, I think. Because I'm a pharmacist myself, I had all the medication data, so I provided those. Then we had data about all the disposables, reusables, water use, bed cloths, medical equipment, and the packaging. We analyzed all the waste streams. So where does waste go? Is it incinerated or whatsoever? We tried to measure that as well. Then we measured and determined all weight and material composition. Metabolic has all the knowledge, so they did this part. And we needed our key organizational data, like the number of beds in the ICU, square meters, the amount of patients per year, equipment used, etc. So that's what we all collected, and then we start analyzing. Next slide, please. We also had interviews with ICU staff members, infection prevention, environmental advisors from the hospital. We had data requests and interviews with all our medical equipment suppliers. Okay, they didn't give us the data we wanted because they don't have the information that came back, but we asked at least. And we had a learning interview ourselves with our team, with the vice president of LEGO, because LEGO is developing a new sustainable brick, and she really helped us with some hurdles we had. She answered all our questions, and it really helped us to get in the energy to finish the project. Next slide, please. And this is the simple material flow analysis that we showed in the paper. And I'll talk you through it. Like on the left side, you see the water consumption. This is water that is used in IV bags and dialysis bags. Then you see the hydrochloric acid. This is the main component of our dialysis fluid. That's why it's shown. Then a small flow of glass that we use for our medication. Then the medicine ingredients. Then there's a larger flow of synthetic plastics and rubbers. then synthetic fabrics, bio-based materials, metals and chemicals. The largest part is the water and the hydrochloric acid and the glass used for the medication. The other part, like the synthetics, is used for the disposables in the ICU. And then in the Netherlands, we have quite an easy system. All hospital waste has to be incinerated. So from 75 hospitals in the Netherlands, all waste goes to one waste company. And if it's infected, then it has a special treatment with higher temperature, etc. But it's also one company that handles it. So we have a lot of traffic going on there. And then my hospital is a new hospital, so we have a special sewage system that can handle a lot of drugs or water that's contaminated with drugs and viruses, and we have a filter in the end. So if it leaves the hospital, it's at least clean. But only 7 hospitals in the Netherlands have this system. So we, I think, do a great job on that part, but it's only the water that we can filter, not the rest of the trash, the waste. Next slide, please. And then this is the whole material flow analysis. We were not able to show this in the publication, so we made our own. But if you look into it more detailed, then this is what it is. And then I think the most important part is the part in the middle that says disposables. And if you then go from disposables to the left, you can see all the plastics we have. And then the big problem in healthcare is that we use 14 different types of plastics. So you can never recycle this as like in one process. And that's also what Metabolic told me, like, whoa, we have never seen so many plastics and so many packaging in, let's say, one department. And this is what shocked them a little bit, because they said, you will never be able to process it or to recycle this or whatsoever. This is not easy. So you have to make sure that you can go back within a couple of years to, let's say, 2 or 3 plastics. And then you can tackle this problem. So then I started laughing, of course, but I think this is the main problem we all have at the moment, because we never asked the companies to use a certain type of plastic. And then the other big part is the area, like on the left side with synthetic fabrics, the PP fabric. You can see that's the one we use in our disposable clothing. It's like the blue and the yellow gowns. We use a single-use model. And the other big one on the left side, bio-based materials, is fluff pulp. This fluff pulp is made of wood. And it's used in our bed liners. So we have the ones with the plastic layer and then fluff pulp in the middle. And this is quite a bad product. And we didn't realize, but it's because it contains the wood inside the bed liners. Now on top you can see the water and the hydrochloric acid. We do know the mass of all the drugs that we use. We were not able to calculate the environmental impact of all the drugs in this project because there's no information about the environmental impact of the drugs that we use. And I didn't want to estimate it because I think that's not okay. So we do show mass, but we do not show the real impact in this analysis. The next slide, please. Yeah, this is like if you zoom into the plastics, it's the 14 types that keep me busy at the moment. Next slide, please. Then we asked Metabolic, okay, what do we use per patient per day? And they were able to calculate this. And I think the most shocking part is the 108 gloves we use per patient per day. And then followed by 57 compressors, 34 bags of medication with packaging, 24 syringes filled with drugs, and then they also have their own packaging. And in Rotterdam, we like tubes and connectors, so we use 23 per patient per day, and this adds up to 12 meters of tubes and connectors per patient. So it's like an enormous road we can make daily, I think. And then 16 gowns, disposable gowns per patient per day. And this keeps on going. And I think this really shocked the nurses, because we were able to talk to them about this result. We had discussions about it. And then they came up with the question, this doesn't look good. What can we do to change this? And I think that's the setting you need, because then people also want to change their behavior, because that's, I think, the most important thing of this whole greening part. We have to change the way we work. So this really opened the discussion and really helped us as a green team and also the head of the department to start the change. Next slide, please. Then we did the same with the mass-based calculation, and then you can see that this bag in the middle, this is a CRT dialysis bag. We use them a lot. They're heavy, so if you look at it from a mass perspective, this bag comes up as our hotspot. The next, please. Then we asked Metabolic to calculate the total impact, and because we had like the data and we were able to calculate mass of all our categories. From the mass, we were able to calculate the carbon footprint. We could calculate the agricultural land occupation and the water usage per group of products. And then I think the things that really shocked me is the let's say blue one in the middle. If you look at the carbon footprint, you see this 49,900. Yeah. And if you go to the right, you can see this, the same color, the water usage. It's also a bit shocking. And this is the nitrile that is used to make the gloves. So if you buy these gloves, they're made somewhere in Thailand. And if you need nitrile, if you want nitrile, then you need a lot of water to prepare the nitrile. Then this nitrile is shipped to the factories, and there they prepare the gloves. We use them, let's say 1 minute, then we throw them away. Then all the value is gone, together with a lot of water and a high CO2 footprint. So this was also really shocking in the hospital, because one of the board members said, huh? What's going on? These data, are these okay? Are you sure? And I said, yeah, I am sure. This is what happens with the gloves. The other one in the middle with the agricultural land occupation, the green one, this is the fluff pulp from the bed liners. This is the wood we use in those bed liners. So they are also a hotspot that came out of a project. And some other ones are the blue ones in the carbon footprint part, like the 27,000 comes from the syringes with that packaging. And also that one is a hotspot. So next slide, please. And if you take this all together, then you can see in this slide what the environmental effects are per ICU patient per day. And in our ICU, it's like 17 kilograms of materials that we use and 17 kilograms of waste. This is 12 kilograms of CO2 emissions, 4 square meters landfill, and 300 liters of water that we need or use in our patients per day. So I think this is too much. Next slide, please. Then with these data, we had interviews with nurses, staff members, and people within and the hospital and also outside the hospital. And we asked them, okay, if you see all these figures and these numbers, what are the most important hotspots? Where should we start? Now, of course, the packaging with the liquid solutions is a big one. Also the IV bags themselves, if they're empty, nitrile gloves, disposable gowns, bed cloths of the bed liners, syringes and their packaging. Infusion pump tubing sets also came out of the analysis because they contain PVC, at least the ones we use in my hospital at the moment. And we were in the middle of COVID, so also surgical masks came out of this project as a hotspot. So we started with these 7 hotspots with the green team from the ICU, and we already made some nice progress, I think. Next slide, please. And I think the story we tell to all the people in hospital, especially to the staff and all our nurses, is okay, if you want to change this, then we really have to change from a linear to a circular system. And on the left side, you can see the linear system. Like we buy all kinds of nice stuff, single use. We use it sometimes even 30 seconds, and then we throw it away and all the value is gone. So we have to go, we have to change this system to the right part, to a circular system. And we have to make sure that if we use our products, that we can use them again, or even better, don't use them anymore, or try to reduce the amount of gloves you use. We have to make sure that we show people and teach people how they can work in a way that they can still use products or materials, but also show them how they can retain value. So we use this strategy with all the R's. It's called the 10R strategy of circular economy, to help people make the change in their mind, also change their mindset. And I think this really works because people recognize it, they can remember it because of all the 10 R's, and they start thinking at the moment like, okay, can I use this again? Or why do we throw this stuff away? Can we buy reusable ones? Can we wash them? I think that's the setting you need in your hospital, in your department. Next slide, please. Yeah, here you can see the 10 R's. I think you might know them. This is a nice way of starting a discussion with someone. Next slide, please. But then in the end, we had all these data from metabolic, but I'm just a simple pharmacist and I don't have any information about plastics or whatsoever. So we started working together with our technical university Delft. They have a department, industrial design. And in fact, they know exactly what questions you should ask to a company. So we started with, I think, 3 master students, and one of the students started with the gloves. Next slide, please. And then within a week, she said, this is kind of a strange thing. If you want to grab a glove, it's almost impossible. These boxes, they don't work. They just put the gloves in like some kind of a ball. You can take them out. And if you take them out, they fall on the floor and you have to throw them away because they might be infected. So she said, okay, I don't know who designed this, but this is stupid. And then she said, I'm going to design a new box and I will test this with the nurses. And she did within a couple of months. Next slide, please. She started prototyping and she made like a mobile test station with gloves. And she asked the nurses to take the gloves and to check all the boxes. And then they came out with box number 4. It's like a V-shaped opening. Because they really like it if you can grab them with 2 fingers. If it's also has a color that says which size it is, because we just have blue boxes and it says L or M or S, but it's hardly visible. So they also said, we like box 4, we want this opening, but can you please add the color to the box stating at least the size of it? That's what the student did. And the next slide, please. She made this end product. She called it glove, like the vertical glove dispensing system. And this is, and in this way she finished her project. And we are at the moment trying to find a company, a local one, that can use these boxes. And we are also trying to find out if we can use another kind of nitrile that's better for the environment. So within 6 months, I think we had like one student that did a great job, but it gave us a lot of information. And it also reached the board of the hospital again. And she said, well, we need this kind of innovative prototyping way of working to keep people on board and to make, and so they can make the change. Next slide, please. We also added some people from Erasmus University in Rotterdam. We have like a professor specialized in procurement, and we added some people that are specialized in behavioral economics. And with this team, we are helping students, basically master students, to do some projects in the ICU regarding the hotspots. It keeps us busy, but it also creates a lot of energy and a lot of results. And if you want to see our results, we all the master theses are put on a website, www.sustainablehospital.org, and it's open for access, so you can take whatever you want there and make sure you don't do the same that we did, because it's just to help each other. So that's basically it for now, I think. The next slide is, yeah, it says. We also have a national website. It's called the Green ICU, but then in Dutch. I think we cannot translate it into English, but Google might help you a bit there with all kind of tips and tricks for ICUs in the Netherlands and maybe also in the UK. So are there any questions from your side? Yeah, this is the movie about Green ICU. That's not for now, I think.